Reinventing Healthcare in a Post-Pandemic World, the long and short of it. Dr. Soumya Swaminathan is the Chief Scientist for the World Health Organization. She heads the division created to strengthen the organization's core scientific work and ensure the quality and consistency of its norms and standards. Dr. Shahina Dawood is a consultant medical oncologist, professor in clinical oncology in the United Arab Emirates.
Well, quite excited for this conversation, and as mentioned, this is where we're going to deep dive into reflecting on the last 2 years of this healthcare pandemic that the world over has been under. And as has adequately been highlighted in terms of economic facts and figures, we're well aware that women continue to be at the periphery of economic productivity in light of the impact of the pandemic and how it's impacted the various sectors that we worked in. It's also exacerbated many of the pressures that we find ourselves under, especially from a healthcare point of view, where equity remains a significant challenge in addressing the healthcare challenges that women face. So how is it that we need to make sure that in a post-pandemic world that we're able to reinvent healthcare systems to meet the needs of adequate female inclusion? From a science point of view, women inclusion, right up to the impact and rollout of healthcare. Well, I'm delighted to have both my guests with us on the line, Dr. Soumya as well as Dr. Shahina, if I may refer to you by your first names this afternoon. Again, a reminder and a gentle excitement to share with you in terms of International Women's Day to you both. I trust that that's been a day that you continue to commemorate and celebrate, especially in light of the achievements that you both have had in your fields of healthcare over the last few years. But on that note, Dr. Soumya, I'd like to start off with you. Given the wealth of experience and the history that you've shared, primarily having started off in terms of research in tuberculosis as well as HIV, you've really witnessed the various impacts of healthcare scares, illnesses and pandemics, and the impact that they've had on women and the female population the world over. And I'm keen for you to share some knowledge with us as to how not only this in terms of what your history in HIV and TB has taught you, but most importantly how the pandemic itself has fared by perhaps leaving women on the sidelines of adequate healthcare provision. Dr. Soumya?
Thank you so much, and it's a real pleasure to be with you today. Let me start actually by going back, about 20 years or so to when we started dealing with HIV in India. This was a time before antiretroviral treatment was available. There was a huge amount of stigma associated with it because I think any disease for which there is no cure and that people don't understand completely, there's always accompanied by fear. And that fear and stigma actually reduces. The same thing happened with COVID, actually. I saw a lot of parallels between HIV and COVID. So I saw firsthand the impact that HIV had on families and particularly on women, because right at the beginning, there was a lot of stigma associated with the fact that it's a sexually transmitted infection. And even though most of the infections in India were occurring because of the promiscuous behavior of men, especially those who traveled away from home on work and stayed away for long periods of time, they would visit sex workers, come back home and infect their wives. In fact, at one point, the single biggest risk factor for HIV in India was being married and a woman.
Sure.
And that, what happened was that society couldn't accept that. And so invariably the woman would be blamed. And when the husband died, she would quite often be thrown out of the home and so on with her children. There would be a lot of orphans. So I saw that cultural environment and social taboos actually unfairly impact women. I've seen the same thing in tuberculosis, where if there's TB in a family, and particularly if a young girl, a woman had TB, it was said that it would affect her marriage prospects. This in turn then led to secrecy around keeping it quiet. And this also leads to quite challenges in access to healthcare. So this is from the patient perspective or from the perspective of the affected person who lives in a community. From the perspective of healthcare providers, the teams consist mostly of women. We know that over 70% of healthcare providers worldwide are women. And the more peripheral you go, the more towards the front line you go, the more the higher the proportion of women. So community health workers, almost invariably women, nurses in most countries, predominantly women. When you come to doctors, then of course you start getting a balance. But counselors, nutritionists, all of these quite often are women. And so we saw in the COVID pandemic that healthcare workers in general, of course, faced the brunt before we had vaccines, before we had tools for treatment. And it was interesting to see that more women than men were getting infected in the early days of the pandemic, even among healthcare providers. This also goes back to the fact that the PPE that is used, the personal protective equipments that are used, are often designed for male bodies, not considering the convenience and suitability for women. And so we've recognized a lot of these things. They've been there a long time, they've been hidden, but the unequal impacts on women of the pandemic, both in terms of women having to do childcare, take care of families, particularly during lockdowns when schools were closed, and take care of their professional lives. As a scientist, I know that more women scientists than male scientists have had to take a break in their careers because of these added. So these are just some of the kinds of impact that diseases have on women.
Very right. Thank you so much for that, Dr. Samia. And I think really provides some perspective in terms of understanding the vulnerabilities that women have in various societies, and how various illnesses also impact us in a much harsher light versus our male counterparts. Dr. Shahina, perhaps I can also come to you here to share some of your thoughts, especially given that you work in an environment that I believe that has shown that there's been increased digital innovation, increased access to really democratize the participation of women. But help us unpack the reality versus some of the concerns that do remain regarding the inequities that exist regarding access to healthcare for both women and girls.
So I come from the United Arab Emirates, and one of the things about the United Arab Emirates, and this really comes from our leader here in the UAE, is that women and men have always been treated equally, and that has been a tremendous opportunity for all of us here in the UAE. But going back to the pandemic, when we were hit by it in March of 2020, as rightly said by a lot of people, we were simply not prepared. And at that point, no matter how much digitalization you had, that didn't help us at the time that we really needed it the most. In terms of trying to see how to cope with everything that happened as a result of the pandemic. Now, I'm an oncologist, and one of the things that we didn't want to do was to shut down healthcare for patients who had cancer, who needed access to treatment. The largest proportion of patients that come to us, because the leading cause of cancer here in the UAE is breast cancer, and the majority of those patients are women. To not allow them to come for their screening, to not allow them to come for their treatment, to not allow them to come for their surgery, was something that we simply did not want to do. And that was what was happening worldwide. So we needed to balance that. We needed to be able to find and strategize plans so that, yes, we were dealing with the COVID pandemic, but at the same time, we were allowing women to come in to get the healthcare that was needed. And I think that's where the digitalization actually helped. We introduced telemedicine, which was not in widespread use before the COVID pandemic, but then escalated during the COVID pandemic. I think it's now de-escalating again. It's something that we should think about really incorporating as a routine measure, but we did utilize it quite a bit during the COVID pandemic, and that allowed women to be able to contact their physicians, to be able to reach out to us when they needed us, in terms of if they had a problem, in terms if they had a breast lump, or they had something that in terms of signs or symptoms of something sinister, and they couldn't get access to healthcare at that time. But that was for patients. When you're coming to the physicians or the healthcare worker perspective, on the ground, as Sumaya has rightly said, the majority, 70% of the healthcare workers are in fact women. And we saw a huge impact on the female healthcare force, both from a nursing perspective, administrative perspective, physician perspective. As women, we not only have our jobs, we have home lives that we have to take care of. And trying to find that fine balance was difficult. Children were not allowed to go to school, and then to have to balance keeping your kids at home at the same time being at that front line to actually help the whole COVID wave that was happening was a very fine balance that really taxed a lot of us at that time.
I can only just imagine, and you raise a very valid point, because it does speak to previous conversations we've had here at the Leading Women Summit, which highlights the impact of the pandemic on mental wellness, on mental well-being, on the spiritual quotient, and making sure that we're able to humanize commerce. And I'm keen, as we stay with you there, Dr. Shahina, if you can expand on that, primarily when it comes to humanizing the healthcare workforce, understanding that the people at the front lines who are assisting us do need to be taken care of too.
Yes.
Is that something that's changing and evolving, and I guess a new conversation that's making its way to the tables of healthcare professionals like yourselves?
Absolutely, yes. And I just led a discussion on this a couple of months ago for, mental health well-being in the oncology realm. But obviously, it's something that's there for the whole healthcare workforce. You must have read about the great resignation drive that's happening in the US right now, and a lot of it is actually healthcare workers that are coming out of their jobs simply because of the stress of what happened in the last 2 years, and it's taking its toll on their mental well-being. I can tell you, at the beginning of the pandemic, we didn't think about it. The only thing on our minds was getting through what was happening to us, because we'd never been faced with a situation like that before, getting our patients treated both from a COVID perspective as well as a non-COVID perspective. In the UAE, like I said, we didn't want to shut down essential services like cancer services, like cardiovascular services, which is what happened worldwide. So that added another layer of stress. And unfortunately, we didn't think about the mental wellness of our healthcare staff, and we lost a lot of staff. And again, the data is very clear. A lot more women have resigned from their jobs. A lot more women have lost their jobs due to a variety of different reasons during the pandemic, but a huge portion of that was their mental wellness. It's only now, I think, in the later portion of 2021 and now in 2022 that we've started to focus on it. I can tell you, even though the administrators were tremendous during the pandemic, they really helped the healthcare workers out as much as they could by trying to provide those PPEs that were in short supply, by trying to keep those services open for patients, by trying to help us at various levels. But mental wellness was not addressed. It is now being addressed because we're starting to see the impact of what's happened in the last 2 years on the mental wellness of not only physicians, of nurses, of administrators, of everyone. And it's only now that administrators have realized that it was something that they should have addressed right from the very beginning. And we're having those group discussions. We're having those meetings where we're sitting down with nurses. We're asking them what they need from us, how we can help them sort of discuss what's happened in the last 2 years, because simply talking about it helps. We haven't been able to hug anyone for the last 2 years, and that helps, just making you feel like you're connected to people. As an oncologist, I used to hug all my patients. I haven't been able to hug anyone in the last 2 years, and just that touch is something that's been really missing. And now we're starting to come back, and we're starting to address those issues.
I find that so refreshing, and you're quite right. Many of us miss that common interaction and just a human connection that we long for. And perhaps, Dr. Soumya, I can come back to you here, because you have been spending time at the Global Pandemic Preparedness Summit for 2022 in recent days. And I'm well aware that Dr. Tedros Ghebreyesus has made it clear that this might not be the last pandemic that we face. So if anything, this teaches us that we need to prepare. But in our preparedness, how do we make sure that, as highlighted by yourself and Dr. Shahina, that we allow more women not only to participate actively within the full spectrum and value chain of healthcare, but that we also ensure that women play a key role in the conversations, in the preparedness, and the strategies that need to be implemented in order to meet future pandemics and being future fit for them?
I think you've hit the nail on the head. The participation and the voice of women healthcare workers in decision making is extremely important. And far too often we see that decisions are made top down by policymakers who very often are men, and they're not even thinking about things that might affect women. Like I mentioned, the personal protective equipment. How do women get to go to the bathroom? What happens when they are menstruating? What happens to women who have to breastfeed their babies, and so on. So there's a lack of awareness and sensitivity, and therefore, this is what we talk about. The gender inequalities are so entrenched. And again, it's not because anyone wants to do it on purpose. It's just that if you don't involve women, if women are not, and we've said more than 70% of women in the health workforce in most countries. In some countries, it's much higher than that, over 80 or 90%. But if you look at leadership positions, very often you will find them all occupied by men. So I think we have to make conscious choices and decisions there, and that governments really need to wake up to the fact that if you don't bring gender equality, particularly into senior decision-making positions, that you cannot advance. So that's the first recognition, I think. The second thing is we have to invest in our workforce. We take for granted the work that our doctors and nurses, they rose up, during the pandemic. They put themselves out there at risk, when everyone else was trying to hide from the virus. We lost so many health workers during this pandemic. And yet we don't take seriously the needs, their needs, not just their physical needs, but also their needs for support, for mental health, but also for ongoing training. Medicine is such a fast moving field. Technology is changing so rapidly. Countries are moving to digital work, and many of our workforce may not be very familiar with using these digital tools. So I think ongoing mentorship, training, and being able to have these two-way conversations is really important. So the WHO, in fact, has called 2022 the year of the health worker, the year of the health workforce, and particularly focusing on nurses and community health workers and so on. So I think we really need to bring a focus on this silent community of workers that provide healthcare. We have to focus more on quality. And of course, you talked about future pandemics. What the WHO has always said is that spending on health is an investment. It's not a cost. And providing universal health coverage for people is the other side of the coin as providing health security. We cannot prevent future pandemics if you have not invested in the health system, particularly in people. And we know now that there are gaps in every country, from high income to low income. There have been gaps, there have been deficiencies in the response. Every country now needs to look at where they need to supplement the workforce, where they need more people, where they need training. You need resilience in the health system. You cannot keep on flogging the same people to work 24 hours a day for years on end. So all of this needs investment. We have digital technologies now. We have this wonderful genome sequencing that can identify and detect pathogens very early. We need to put in place systems. But most importantly, we need to build, the primary healthcare systems and at the level of the community engagement. Because as my colleague Mike Ryan often likes to say, pandemics begin and end in communities. They don't just come out of the air. And therefore, our responses also must start by thinking about what communities need and how they will respond. And women are usually the people in the community who take responsibility for health matters.
Yeah, very important you mentioned that. A key theme that I'd like to share with both of you as we start with our concluding remarks here, and perhaps Dr. Soumya, you can start us off here first, in light of the fact that you've been engaging quite heavily on the vaccination rollout. We're well aware that there are great inequities between developed and developing economies, and so much more so for women who happen to be in developing economies. But it also speaks to the level of education. Many of us can recall a time when vaccinations were about to be rolled out, that there were many questions asked about its impact on the reproductive health care of many women. And it almost seems as though reproductive health care, breast cancer, illnesses that might be specifically associated with women are still left by the wayside as to how it is that we do address them adequately within the current scope of challenges with HIV, with TB, and even the likes of the COVID-19 pandemic. But how is it that we also need to adapt the education of women like ourselves around the table, who are in corporates, who are in business, who are in media, to fully understand the rights and the role and responsibility we also have towards contributing to our own personal healthcare, but even including our awareness within the circles that we happen to have access to. Dr. Soumya, perhaps we can start with you, and Dr. Shahina, you can share your closing remarks with us too.
I think you've raised really important issues, and I think we start by talking about them, by raising awareness. We have to start with our young girls in school and in college, because that's when their thinking is shaped, and that's when they're most impacted by gender and social norms. And particularly girls who are growing up in patriarchal societies often will not have the opportunity to believe and think that they can do something that perhaps their brothers are allowed to do or could do. There are far too many places in the world. So I think having role models in the country, in communities, talking about it, getting celebrities and others to discuss, bringing up sensitive topics like menstrual hygiene, for example. If political leaders start talking about sanitation and menstrual hygiene, I think that makes a huge difference. And then that starts actually the action, because anything which is hidden is and not talked about, we often say, what's not measured cannot get done. So the first thing is to really capture that data, identify the gaps, talk about it, raise awareness, and then, of course, find solutions and make sure that we see access to healthcare, for example, in most parts of the world is that women are further behind, including in COVID vaccination campaigns in many countries. So data is very important. And at the WHO, we collect data from around the world. And even during COVID, we found that less than half of the countries that report to us were able to disaggregate data by gender and by age. So they're very basic things like, male, female, and age group was not available in the data. So we need to start by looking at these very basic things. And then, of course, I think, those of us who should work with young women, mentor them, spend time, talking to them. I think girls should grow up believing that they have the same opportunities as boys, that they are genetically not different. Biologically, there may be differences, but in terms of what they can achieve, there should be no barriers that are special to women. Yeah. And I think we have to make that the norm.
Definitely. Breaking down those barriers. Dr. Shahina, perhaps you can share your concluding remarks, especially regarding the democratization of access to healthcare and women also feeling empowered within their own individual capacities.
Well, I think we've learned a lot in the last 2 years, and the pandemic has certainly taught me that there are certain things that we need to be aware of, and that we have to learn and process going forward. Number one, we have to enhance education at all levels. And I don't think it's only for women. I think it's for everyone. The vaccination drive we are in a developed country here in the UAE. And initially, I can tell you during the vaccination drive, a lot of people, men and women, including physicians and healthcare workers, did not want to get vaccinated. And I think it was the lack of education. And so education is key. Whatever topic you're talking about, whatever gender you're talking about, you have to have education. In terms of women specifically, I think they need to be empowered. They need to be empowered both at a leadership level, and I completely agree with Soumya. We don't have enough female leaders to make those decisions in those decision-making positions. We need more of them. We need to empower them, but we also need to empower women as a whole to take charge of their own health. During the pandemic, it taught us that we can't wait for physicians to call you. You can't wait for those campaigns to make you more alert. You need to be self-aware. So I think women need to be empowered at every level. And I think lastly, at least for me, what I learned, and I think that's very important, we're talking about innovation, we're talking about digitalization. And if there was anything that happened during COVID, things became digitalized. We had so much innovation in that particular arena. And I think it has led to both good and bad, points that have arisen. And what I've learned is it has caused a lot of burnout, especially for women. Women are working a lot more. There's no barriers towards working because of the social digitalization of everything. Plus, they have to handle their families. It's something that we need to balance, and that's why I think burnout is something that we're going to see a lot more of in the coming a few years, as well as we need to focus on mental health, both women and men alike. And it's saddening to see that the number of jobs lost and the number of resignations seen has actually been higher amongst women than men. And I hope that that changes. The stats are there for everyone to see. So I hope that that changes in the next couple of years.
We certainly
We've
hope
also
so,
seen
Dr.
gender-
Shahina. Sure, go ahead, Dr. Soumya.
No, I was saying apart from the fact that more women have lost jobs, both in science and teaching and in the workforce, we've also seen a tremendous increase in gender-based violence
Yes.
against women and girls
Yes.
because of the fact
Yes.
that, people were locked into homes. And again, we really need to address those social issues in addition to thinking about, the health systems. Otherwise, the status of women in society is not going to improve.
Definitely.
Absolutely.
Very important issues that have been mentioned here by my two panelists, and really allowing us to fully embark on understanding the impact on the healthcare sector and fraternity, not just in terms of the primary healthcare that we receive, understanding the woman involvement and participation in the full value chain of healthcare, but also the ancillary factors such as gender-based violence, such as mental wellness, and of course the impact that that does have broadly then on society. Thank you so much, ladies, for joining us. Really appreciate the time and the insight that you've taken out to share with us today. And again, we appreciate the contribution that you continue to make to the healthcare agenda, not only locally, but from a global point of view. So thank you very much to both Dr. Soumya Swaminathan, who is the Chief Scientist at the World Health Organization, and Dr. Shahina Dawood, who is a consultant medical oncologist and professor in clinical oncology at the UAE.